The new approach that the Care Quality Commission is taking to hospital inspection is radically different from what we've done in the past. But we want to build on the experience from the past and build on the work that Sir Bruce Keogh led earlier this year. What we really want to do is go into a hospital and find out, firstly, whether it's safe, whether it's delivering effective care, whether it's caring, whether it's responsive to patients' needs, and finally, whether it's well led. And we will be assessing the hospital against all of those 5 criteria, but we'll also be assessing individual services like A&E, medical care, surgical care, maternity, paediatrics, etc. Well, I think first thing is we need to go into hospitals and really find out what some of the problems are. And my guess is that we will find it is different in different hospitals. So we will go in and we will look at all of these core services, and we will be able to tell relatively soon, I hope, how well they are doing on safety or on effectiveness or on caring. And then we'll be able to suggest to them how they can make improvements. Now, it is not the Care Quality Commission's role to supervise the improvement. That's the responsibility of the Trust and of other agencies. But we will, I hope, give a hospital a clear diagnosis of what is good and what is bad, what is not working and what is working, in order that we can then leave it to others to make the improvements, because the CQC will need to come back and re-inspect, and we would be marking our own homework if we were responsible for doing the improvement. Well, clearly one of the issues that has already surfaced is about staffing levels. And I think we need to look at the staffing levels, not just at a hospital level, but actually at a ward level, at a service level, to see are the staffing levels, do they match the needs of the patients, the severity of illness, the acuity on those wards? And are hospitals really measuring that acuity effectively so that they can balance the staffing to match the requirements? I'm a great believer in the combination of data and direct observation. That is what we will be using in CQC, but I think we now do have a lot of information that's nationally available that will help us to know about our 5 key questions of safety, effectiveness, caring, responsive and well led. And so I'm hoping that QualityWatch will be able to contribute to that. But I also always believe that we need to do inspection as well, because there are some things that you can only get by being on site and looking at whether a ward has a safe environment, whether it's got safe handling of medicines, all of those things.